Hello from wherever you are. Mark Di Pasquale here, speaking today about calcium and the importance of calcium in our blood and in our body. Most people think that calcium is just bones, and that's as complex as it gets. But I'm here to tell you that it's much more complex than that. Calcium is far more important than just understanding that it's just in our bones and that's all it does. It has many, many different systems that it works in. Pretty much all the systems, just going through the major key factors that are pulled out of a lot of the research, which has been coming out over the years. We're understanding more and more. Firstly, calcium is an essential building block to good health, not just the bones. It is important in muscle function. It's part of the contraction cycle of muscles, everything from every single muscle in your body to our heart. Very important. Our blood vessels have muscles within them, so calcium is a very, very important component. Now, magnesium works with calcium and vitamin D to help keep bones strong and prevent osteoporosis. So calcium on its own can't be absorbed out of our food or in a supplement. We need to be having enough magnesium in there, and also vitamin D. Vitamin D3 is important in the uptake. So we call them calcium's allies, and very, very important. Now, 1,000 milligrams per day is recommended, the intake of calcium for both men and women over the age of 19. Now, how do we get it? And how do you get yours? Well, we can supplement it. That's a very good way of getting calcium into the system. More on that a bit later. We can get it out of dairy products. We can get it out of things like milk, yogurt, fish, salmon have high content of calcium as well. There's many sources in nature and in diet. And it is important to understand, firstly, that we should be getting as much calcium, magnesium, vitamin D, all the vitamins and minerals out of our diet rather than supplementing. First of all, supplementing is something that helps us in a diet that is probably deficient, or whether our body can't absorb or it can't metabolize the vitamins and minerals in certain cases. That's very important too. So that's why we would use a supplement. So absorption rates is that a big key is that the percentage of calcium absorbed from food on average by infants and young children who need a higher amount, quite a substantial amount of calcium for building, they get about 60% of their calcium intake from the foods that they eat. However, adults over the age of 21, the studies show that only 20% of calcium comes from the food we actually eat or is absorbed. So it doesn't mean that the calcium is not getting in our systems. It means our absorption rate, to be able to metabolize the calcium, drag it out of the food, put it into our systems, is only about 20%. So that is much lower than a child in the building phase of our lives. So that's something that we need to be aware of as well. So women and calcium, it's very important that calcium factor in women is I think more important than in men, because women are more predisposed to losing calcium content as they get older. And that is called osteoporosis. That's basically where the bones don't or lose the calcium content that they've been holding over the years. And if we think of our bones or our skeletal system as a calcium bank, for many years when we're young, we make deposits into that system, like putting calcium into the bank. And then after the age of 21, we're pretty much pulling out a lot more calcium than we're actually able to get in, due to the issues with regards to the absorption, as I've just spoken about here in these research articles. So clinical trials in women with PMS have found that calcium supplementation helps reduce mood and somatic symptoms associated with PMS. Now, that's fantastic. The reason why that is because if we have calcium supplemented, the levels of calcium will be in the blood will be higher than what it would normally be. So the body doesn't have to use a lot more energy breaking down calcium out of the bones and putting it into the blood. It's already there to be used. So that's, as we get older, especially women, calcium supplementation is pretty important. Now, also worldwide, 200 million women are affected by osteoporosis. And those statistics tell us that women are 4 times more likely to develop osteoporosis than men. So it's very important to understand the importance of calcium in our diets, men and women, as we age. Women taking a calcium supplement have a 22% lower incidence of death. That's in the that's in the research. It's quite interesting why that, just straight off the line, why these things are actually being researched, but it basically comes down to the circulating calcium available in the bloodstream. One of the things that is quite good to be advising as a practitioner, as a doctor, as a chiropractor, is when a patient comes to me and they're having trouble sleeping, they're having irritable sleep. The first thing I recommend is a shot of calcium, a dose of calcium right before bed. And the reason why this works in many cases is because putting the calcium into the bloodstream before sleep, that means that there's that calcium in the bloodstream while we're sleeping. So therefore, if the body needs some calcium, it doesn't have to do extra work and break down calcium out of the bones and then put it into the bloodstream to then be absorbed and in different or various areas of the body that it needs it. If we supplement it before bed, it's already in the bloodstream. So really, really great way to have better sleep. And I just find it's just, it's just a big help for a lot of people. So let's now move to this information here. Benefits beyond your bones. It's important to understand that. There are many benefits. Now, this is a compound here, Isotonics Calcium Plus. This is a supplement which has calcium plus other nutrients that are very important in metabolizing calcium or absorbing calcium, and then also other things that the body needs in the same system. So the key ingredients are calcium, magnesium, manganese, vitamin B2, vitamin C, and vitamin D3. The primary benefits are this aids in healthy bone growth, relieves symptoms of mild arthritis, helps relieve symptoms of medically diagnosed tenosynovitis, helps decrease symptoms of medically diagnosed fibromyalgia, relieves symptoms of menopause or premenstrual tension, reduces mild migraine symptoms, decreases symptoms of mild anxiety, helps relieve symptoms of mild tension headache. This is fantastic too. When one of my patients has a headache, highly recommend a shot of Calcium Plus, okay, just to allow the calcium into the bloodstream. Probably a little bit of deficiency, that's why we're getting a bit of the headache. It can settle it down, just relax all the muscles off. Relieves symptoms of mild sciatica, relieves muscle pain and cramps, helps promote blood circulation to the peripheral areas of the body, the legs, hands, the feet, relieves symptoms of soft tissue trauma, aids in the management of muscle sprains. A diet deficient in calcium can lead to osteoporosis in later life. Calcium can help prevent osteoporosis when dietary intake is inadequate. So there are a few foods which are very high in calcium and also the other compounds and minerals that are listed in the ingredients there. But what makes Isotonics Calcium Plus unique, and why is it that we would want to be supplementing with such a powder form rather than tablet form? So firstly, calcium is essential for building and maintaining strong bones. Isotonics Calcium Plus provides the body with an optimal blend of calcium, vitamin D3, magnesium, and vitamin C in an efficient isotonic solution that is readily absorbed by the body. Isotonics Calcium Plus paves the way for powerful results since it is in an isotonic form rather than a tablet. So the understanding of this is, and the research has been done on whether it is the body absorbs nutrients out of tablets more or out of solutions more, so out of a liquid. The obvious thing is if we have it in liquid form, when it goes into the stomach, it then moves through the small intestines much more quickly, and then it is absorbed, or a much higher percentage is absorbed into the bloodstream compared to a tablet. So when a tablet goes into the stomach, it has to break down in the stomach. It generally breaks down in stomach acid, so it gets denatured and killed right there. And also sometimes the tablet moves out of the stomach into the small intestines too quickly, because we may have a bit of water with it, and it just moves it out of the stomach into the small intestine, and therefore it doesn't break down quickly into the intestine, and that tablet pretty much just passes through a lot of the time. So sometimes we're taking tablet forms, we don't actually absorb the nutrients that's actually in the tablet, so it's a big waste. Calcium in tablet form is difficult for your body to absorb. People may fail to absorb tablet calcium supplements because the calcium supplement is not blended with vitamin D and magnesium. These are necessary to aid in the absorption and use of calcium. Even if the calcium tablet is blended correctly, it may be difficult for the body to utilize or break down the calcium because it is in tablet form. Many calcium supplements exist in the marketplace, but only Market Australia's Isotonics Calcium Plus delivers a potent package of calcium and complementary nutrients, as I mentioned, the magnesium, manganese, vitamin B, the vitamin D3. Also in an isotonic form, so the isotonic delivery system, which is a powder mixed with a certain amount of water. And then it's the correct pH when it goes into the stomach. So the stomach sees that it is the correct pH to then move it into the small intestine straight away. So the pyloric sphincter at the bottom of the stomach opens up straight away, lets the fluid out into the small intestine, which is why we get more absorption of whatever's in that solution. This translates into a lower cost overall when compared to calcium supplements in pill form by making more of the active ingredients available to the body. So don't be misled by ingredient amounts on the bottle. What really counts is the amount of active ingredients that your body can ultimately use. So when we go to the pharmacy or the chemist and we look at a calcium supplement and we see that it has more calcium per tablet than a powdered form, don't be misled by that, because a tablet form, not only does it have binders and fillers, etc., but the percentage of absorption of that calcium and those other products will be a lot less. Our calculations, we work at around about 20 to 30% of absorption. So if we're having 1,000 milligram tablet of calcium, we'll get 200 to 300 milligrams of the calcium in our bloodstream. Whereas if we're having, for example, 500 milligrams of calcium in a isotonic solution, being powder mixed with a certain amount of water, we work on about 95%. There's about 450 to 480 milligrams of calcium will get into the bloodstream. So much more cost effective, much better way of taking vitamins and minerals. The final point with regards to taking vitamins and minerals is sometimes we may have issues with metabolizing certain vitamins and minerals. That's where the importance of supplements come into play, because if we're reliant on having vitamins and minerals only from our food, and we're not having as much in our food because we're not eating the right types of foods, and then adding to that, we're having a problem metabolizing a certain compound, such as calcium, or such as vitamin D or manganese or some other mineral, then we'll definitely become deficient. And just having it in our food alone won't make us sufficient. It's actually a problem with the metabolization or the use of that vitamin in the system. So it's very important to understand that as well. Doesn't mean that if it's going in, it means that it's getting to where it needs to get to and the body is sufficient in that nutrient. So that's also very important. But that takes a little bit more help with regards to your practitioner or from your practitioner to understand that and diagnose certain deficiencies with regards to health. So there we have it. Pretty important information on calcium, how it interacts with other minerals for the absorption, how important it is in many systems of the body. We should be taking it in liquid form rather than tablet form. Any questions on any of this information, let me know. I'm happy to help in any way I can. Do your own research. Look up calcium, look up what systems it's part of. I'm sure you'll find it in all the systems. Okay. That's it for today. Until I speak to you again, have a good day and look after your health. Bye for now.